So when you're done with the meeting or the audio, you have to give your supervisor a copy of this form, sign and initial, so you can fulfill the requirements of DCF for all the training that we're gonna share today. How many of you know what are the national patient safety goals for the behavioral health component in this organization? Those are the ones that Joint Commission issue every year for all the accredited institutions under their accreditation. No? You just had training on one of those, the last training you had. No. Suicide. That's one of them. As one of them I consider the most important ones because of the type of facility that we have. The other one is reconciliation medication. So that means that you have to make sure that your inventory of medication is accurate according to what the client was prescribed. The second one is, or the third one is improve the accuracy of identification of individuals served. And how do we identify people here when we do medication administration? We ask them for the Social Security, and or the Social Security and the name will be two, or they look at the picture and they ask them for the Social Security. That would be another way of doing it. The other one is improve the safety of using medications, meaning you have to make sure that when you administer the medication, you have to make sure of the dose. You have to make sure that you tell the patient where you give them, and you have to make sure that the frequency of the medication is correct. And we're doing all of these. The other one that I have here, reduce the risk of healthcare associated infections. Who said? Who talked about infections? Yeah. Meaning we have to make sure that patients, but also staff members, abide by all the requirements, like wash your hands is the most important. Every time I wash my hands, even though I'm not at the facility, but every time I open a door or I go to the elevator, I don't use my finger at the elevator. I use my, me too. Okay? When I sneeze, I don't go I go like this. Also, when you go to the bathroom, wash your hands. And when you get out of believe me, I've seen people in the restrooms that they're just going in and out. And I think it's disgusting. So especially here, make sure that you're constantly washing your hands. I was very surprised to see we're supposed to follow the guidelines of the World Health Organization, because they have a big program, and you guys know about this, the medical people, that there are specific guidelines, and they did a lot of studies around the world. And I was surprised to find that one of the poor adherence to recommended hygiene practices are the male staff. They're one of the biggest, yeah, believe it or not. They don't wash their hands. The people that work during the people that work during the week versus the people that work during the weekends, they don't wash their hands often enough. I mean, I'm not making it up, guys. I guess so. Nursing assistants don't do it as often as they should. People that wear gloves, they take off the gloves, they throw them away, and they don't wash their hands. You're supposed to wash your hands even though you wear gloves. I'm going to say another one, but the people in intensive care unit, it says here that they're very, they don't do, it's not that they don't do it, but they should do it often because they're constantly, treating clients, and then you go from one client to the next, and then you cross-contaminate people. Also, when something like biomedical waste is on the floor, we shouldn't call the staff at the housekeeper staff. We're supposed to have a box in the medical offices to handle that type of waste, because there's a special way. We know that, right? Medical staff, there's a special way to handle that vomit, urine, whatever it is. No, you're not supposed to be cleaning it. Whoever in front of it, if you're with a client and that happens to you, what do you do in a hospital? Do you call maintenance or you do handle it yourself? I'm curious.
You call housekeeping.
Really?
Housekeeping, yep.
I
mean, you wash yourself off.
Yeah.
And they're prepared though.
And what do you do with the patient?
If we have the blue
There's
pad,
cleans them.
we put them on top, and then sometimes if there's something on the floor, I'm waiting for housekeeping.
But do you cover, right?
I cover it with a blue pad, and I put, you have all those yellow thing that says wet floor.
So, but you don't leave it open so somebody can step on it.
No. You block the area, you protect the area.
Okay.
If it's goat urine, we.
If it's good, you.
That's a different story. We call Ricky.
We just show
Okay, so those are basically the national patient safety goals for behavioral health care. And this is only 4. Hospitals are more complicated, so thank God we only have 4. Then we're going to go to patient safety. We are very good here addressing patient safety because when we have a concern, we put clients on one-on-one, so we're pretty good about it. One of the highest risks in this environment is suicide, falls, and the other one is seizures. So, so what do we do when we see a client collapse on the floor? Everybody.
Tend to the need. Correct. Find out what happened. Vital signs.
Okay. And if that person is totally like not manageable, then we call 911. Okay. So tell me, which code do we call when we have an emergency of that sort? Code blue is for medical emergencies. Well, everybody knows that one. So what is code red?
Fire.
Ooh, look at you. What is code gray?
Bomb. No, security assistant. Security assistant.
What does that mean? So what do we do with an agitated person is in front of us?
CPI. Help them.
Okay, so now that we can talk about CPI, so what are we supposed to do with CPI? You see, you're teaching me instead of me teaching you guys, which is great. That's the goal. So tell me what happened with the CPI. What's the crisis development mode or model of the CPI?
So prevent the patient from harming themselves more or any other staff member.
To de-escalate the situation.
Without any physical violence.
Usually, assigning a patient to one staff who patient may have some type of rapport with, instead of everyone dealing with the patient.
And in the moment, what do you do? We have a patient with anxiety and he's going crazy. What do you do?
We don't call them crazy.
Thank you.
Restrain.
That's very important. Actually, that's very important. We need to be supportive.
Ice cream.
If that helps, let's get
No joke, Bedford VA decreased their restraint rate by like 50% giving vets ice cream.
So when somebody is going crazy, you need to be supportive, Like, I understand, come on, let's take a breathe, let's count to 10, whichever way you can be supportive. Sit down, you want water, whatever it is. The second one is, what happens if they're very defensive? What do? You direct them. You don't give in to their behavior. You just be straight to the point, tell them what to do. Okay? Acting out. What do we do when somebody's acting out? That happens a lot here. Nonviolent physical crisis intervention. What does that mean? Did anybody take the CPI class here? What does that mean?
If they're really aggressive, it usually means restraining them in a protective way so that they're not going to hurt you and they're not going to hurt themselves.
Perfect.
And if there's a lot of tension, if there's a lot of like trouble, if somebody it's not doing well, but they're not expressing or they're not showing any violent behavior, you're gonna have to do some therapeutic intervention. You either send them to their therapist or somebody that they feel like very close to, somebody they can relate to and talk to until they go see the therapist. So, very good, you see? I don't have to do a lot of the work here, guys, which is great. You even knew the codes. So what happened when an employee, that happens to me a lot now since I'm doing HR. What do you do with your coworkers when they are getting violent or their behavior is not, nice or?
Same thing.
Same thing.
You know,
Except sending them to their therapist.
a lot of times it's because people feel like they're not, nobody's actually listening to them. You sit, you let them speak, and then you say your piece. Usually they come down.
Okay. What works for me is that I tell them that I understand what they're going through, even though might not be the case, but everybody goes through it. One point or another in their life, somebody is troubled. So, you try to build some sort of like common thing between the two and just behave as a normal, regular being that you understand and that you can help out. And if you can, you find somebody else who can help out, and if they don't acknowledge that, then what I do is I direct them. I said, I'm not having this conversation. This is over, and I walk away. The best thing that you can do to an employee that is being aggressive with you is to walk away. That doesn't say that you're not man enough or good enough or smart enough to deal with the situation. On the contrary, that says that you are mature, professional, that you know when to move out of the situation. So that's basically about, and also, please, don't wear flip-flops to work. Don't wear open shoes because if you have an accident, guess what? Workers' comp. You're gonna fall, or it's gonna be an accident, and you're gonna go and they're gonna ask you what happened, and you say, "Oh, I was wearing sandals and I was running and I tripped and I fell." I don't know what's gonna happen with your claim. They will give you medical assistance because they have to, but that's out on the open. When you have an accident on the job, you need to go to your supervisor. And then hopefully the supervisor will send you to the nurse. We're not to treat anybody here. We're supposed to send the person to one of the authorized providers by the workers' compensation policy or a management company, and your supervisor or the nurse is supposed to give you our policy number, our group name, and tell you where to go. When you go there, you provide that information, and they will know what to do with your claim. Once you go there, it's like us. They have to submit a claim. They're not the ones handling everything. They're just a provider for the insurance company. So if you don't have that information it's going to be very unlikely they're going to be able to process that claim. Okay, and when they give you something at the provider's office, a paper or an order or something, please bring a copy of that to your supervisor so I can include it in your file, because I'm going to have to either, depending upon the severity of the accident, you're going to either have to stay home. We can put you in another sort of duty in these facilities where you can be working, but you're not doing work that will prevent you from being mobile or doing something. So, or if they send you home and you cannot be here, I will have to follow up on your claim. Is that understood? Huh?
What about in the event of an emergency?
What about an emergency? We send you with 911 and they will go to a hospital and
I don't want our nurses getting sent people who have emergencies.
What do you mean?
We want to make sure that everybody knows that that's for a non-emergent
Oh yeah, of course.
issue.
Yeah, if you have a heart attack here, it's not a workers' comp, but we'll send you to 911. If you fall because you're cutting tree branches and it's maintenance, and they fall and they're unresponsive, it's a workers' comp. We're going to call 911 and we're going to send you to a hospital with that information. Yes, thank you, doctor. And we're supposed to have a ledger of all the accidents in the facility. So in addition to providing the information to process the claim, your supervisor or the nurse is going to have to log that information to have it ready in case we are audited every year, believe it or not. They come to audit us and see, they go around the facility and they see, they do a risk assessment and they provide recommendations, which we have 60 days to comply with, just to make sure that the place is actually safe.
Do we have incident form?
The nurse has it, or your supervisor. But just so you know, I'm creating a drive that will have all of these forms, so you don't have to ask HR, you don't have to ask your supervisor. The forms will be available, but you need to follow procedures, guys, because communication is key. If we don't know what's going on, we can't help you. How many of us know what HIPAA is? Please tell me all of us know what HIPAA is.
Oh, yeah, absolutely.
Okay. What about 42 CFR Part 2? Okay. HIPAA is for everything related to private information being on a healthcare setting or financial setting, educational setting, anything that has, anybody who has your private personal information, social security, date of birth, anything should be abide by HIPAA, meaning they should not disclose your information to anybody without your consent. Okay, since substance abuse, it's protected because it's a disability. Also, Congress thought it needed an additional layer of protection because of the nature of the disease, because there's a lot of stigma. So they created this other legislature. Is that how you say it? And they provided certain requirements for facilities or healthcare organizations to release information about substance abuse treatment. So in addition to the HIPAA laws, substance abuse programs have to abide by these other requirements, which says that only for specific purposes you can disclose that information. Not for everything, and also that the patient has to give written authorization to provide that information. That's why we're very careful here when we disclose a patient being in treatment or providing healthcare information such as clinical notes or medical notes and all that stuff. Just common sense, don't allow anybody to do your notes with your user, Kipu user. When somebody asks you if somebody's here on the phone, you cannot acknowledge or deny that that person is here. Take the number, somebody will get back to you. Also, I don't know, when somebody walks in and is looking for somebody, we can disclose if that person is here or not. That not only going home and talking about a client or going to meetings and talking about somebody that you know, you're putting yourself in a very difficult situation. Also, HIPAA is not only about clients, but also about the staff. Meaning, very important, if I test you and you're positive for drugs, and I am the HR person, and I go to your supervisor and say, so-and-so tested positive, and that supervisor for some reason is not prudent enough to discuss the situation when nobody can hear about it, and somebody else knows about it, that's a breach. That's an infraction, because nobody's supposed to know that staff is positive. Now, if you go around telling everybody, that's his problem. But if I heard from him and I disclose to somebody else, I'm also breaking HIPAA, because I should not be even talking about it to anybody. So it's not only about clients, but it's also about staff. If I asked you to help me file stuff in the employee files, and you look at me and you see that I have some disease that is not supposed nobody to know about it, and you go, by the way, I saw Luisa's file and she has this, Did you know that? That's a no-no, okay? So, very, very important. Listen, we have 2 incidents at the gardens, and the police department requested the file, the coroner's office requested the file. I didn't provide the file because they needed a consent from the survivor, the mother, the wife. We're not allowed to. Even if the coroner's office is the person or the individual asking for it, because they're protected by 42, whatever, Okay? Any questions? We all know what sexual harassment is, right? What do we know when we feel that we're being harassed? You confront the person, is the first thing you should do.
Confront the person?
Yes, absolutely. Why not? You have every right to do it. And if that person doesn't stop, you have the choice to talk to that person and report it, or you have the choice to talk to that person, give him, her or him, a couple of days and see if things stop. If it doesn't stop, then go to HR. You have to fill out a form. If you can't put it in writing, he or she said is not enough. You have to be able to put it in writing. If you don't feel intimidated, don't feel bad, it's your right to complain. You go and say, HR, I did it before to my boss. And I was allowed to do it. He didn't fire me. So, and it's not because he was harassing me, basically. So you go and claim, this has happened this day, and he said this or she said that, and I told him this and that. You file the report, we do an investigation, and then we have to come back to you. I think it's between 48 hours. Tell you what happened, and if we're going to reprimand the employee, what are we going to do with that specific situation? And then we have to make sure whatever we resolve that it's implemented. So, any question on sexual harassment? It can be male or female. It's not actually only males that do harass.
So what if you don't feel safe confronting the person? Then you report it.
Then you report it to HR. Yeah, absolutely. Absolutely. Whatever you feel more comfortable doing. Drug-free workplace policy. Why do we have it? Because of the nature of our business, number one. Number two, to protect you and to protect patients. And number three, because we get a discount with the workers' comp insurance that we have for the facility. So what does that mean? Drivers, every time you have an accident, or maintenance, every time they have an accident, you have to we have to test your urine, just to make sure that you are not under the influence. Okay? What else? Every month, we have a random selection of employees, and standard, they will be tested. Number three, if there's a suspicion, specific individual that is acting up or something is off, the supervisor has the right to test you, as long as they fill out a form justifying the behavior and why is that single individual being tested. The procedure is you go test. It goes to a third-party lab, somebody who's not associated at all with us. They do the testing. Then the medical director reviews the results, certifies the results, and then send us the report. If you test positive, you can contest it. You have to, if you want to be retested, we can retest you, but you have to pay for the test. Okay? You can write something up saying why you consent, and we have been through this before. Somebody who tested for cocaine. No, I didn't do cocaine. We retested. It tested again. We do not drop you, or we do not ask you for a new sample. We retest the sample that we have in the lab because they keep part of your urine sample. And they will retest that urine sample, okay? You can ask for another lab to test that sample, other than the lab that was given, that gave you the positive. So just to be safe, if you say, no, I want somebody else to retest it because I'm not confident, we can send it to another lab. Not the one that you want, another lab, okay? Again, you have to pay for it. And this is black or white. If you tested positive, we can't even tell you the levels of the substance that you have in your urine, okay? Again, if you, before you're tested, if you voluntarily come and say, I have a problem, I have a substance abuse issue, we can help you out. We'll figure out a way to, we had that before, right, Rick? Yeah. We have sent people to treatment. That's not an issue. We don't judge you. We want to help you, but you have to disclose. It's not that when I test you, oh, by the way, I have a problem. Okay? It has to be, you have to show some, openness to say, I have a problem. Professional code of ethics. What do I mean by code of ethics? What does that mean? Code of ethics. Okay, so give me an example of ethical behavior here.
Respect each other. Respect.
No? Ethical or unethical?
Which one?
Unethical. Let's go
Unethical,
unethical.
having relations with patients. Severe.
What type of relations?
Intimate.
Intimate or personal?
Business relations? What about business relations?
Personal. Any.
What do you do if somebody if a client comes and say, by the way, I have a business venture that is going to make give you excitement returns, and I mean a lot of money, and I want you to be part of it.
That's great.
No.
What do you do?
Tell your supervisor. Let them know, then tell your supervisor. Then run away.
Okay. Perfect. Do I need to elaborate more? Okay. What about you being an employee and knowing that somebody has a service that can provide to the facility, and then you go to the guy and say, by the way, I work at this facility, I can get you in, but you need to give me 5% of what you bill to them.
Very wrong.
You say, what?
Unethical.
That's unethical. Just checking. Now, as a medical professional, you have some sort of code of ethics that you have to follow, right? Give me an example. Don't provide treatment that you don't need. I mean, don't say that somebody has...
Not part of the facility code of ethics.
Don't say, oh, this client has hepatitis C and he doesn't have hepatitis. I mean, as a clinician, as a medical person, you're not supposed to do that, right? Okay. You went through incident reporting, right? Yes. Give me an example of incident reporting that you're supposed to. And what's the process, by the way? I just want to make sure that you guys learn anything about real incident reporting.
You report to the supervisor.
Document within 24 hours.
Well,
The supervisor.
What happens with that information you provide to your supervisor?
It's supposed to be private. It's supposed to be a private patient. Not private.
Okay. By the state of Florida Department of Children and Families, we are required to report events that happen in the facility, depending upon the gravity of the event. Somebody dies in the facility, we're supposed to report it within 24 hours. And I'm telling you, it happens to us already. We were in the process. I'm sorry. We had a third-party consultant who was doing our compliance. That individual did not contact DCF or file the report online. That was on the weekend, or I thought it was, no, that wasn't on the weekend. That was on a Tuesday. Wednesday morning, I got a phone call from the head of the Department of Children and Family in Miami asking me about the incident. Everything in this community is very small. She found out about it, and she was driving to the facility to talk about it and see what happened. I didn't report it because somebody else was supposed to report it. So when somebody dies, when somebody, an employee kills another employee, or a client kills an employee or another client, if somebody's raped in the facility, did you cover patient rights? Tell me one patient right.
Patient right to have privacy. Privacy, right to
treatment?
Right to
Refuse treatment too.
Refuse treatment? Yeah.
Non-discriminatory practices.
Correct. Disclosure of fees. We're supposed to tell them how much we're going to charge them, or at least post it somewhere. We're supposed to give them our privacy statement, which means how we're going to handle your information, your medical record, how we're going to disclose it. Okay? So you guys are good with that. What about grievances? Did you cover grievances procedures? When a client has a complaint? Okay. First of all, I want to say that if there's a facility where clients do not complain, there's something wrong with that facility. There's going to be complaint, guys. That doesn't mean it's a reflection of you, that you're doing something wrong. That I see that as an opportunity to either make that client feel better or for us to improve. So if somebody complains that, I don't know, give me an example of a complaint.
Why do I have to pay for 10?
For what?
I actually had a grievance.
This is a complaint I get. In our facility, I don't pay for that. Why do I have to pay for that? Why do I have to pay for this? What kind of facility is this? These are the things that I get to pay for. I don't like this.
We had a client turn in a grievance today. They said that the floors in their residence hall weren't mopped enough and that they were getting black.
Okay.
That was a grievance.
Okay.
All this stuff how they work barefoot and then they walk in.
And what do we do about that?
I took the grievance. I told them that I would have a response within 24 hours. I turned the grievance over to the appropriate department and they mopped the floor.
Okay.
And I told the client the floor was mopped.
That was it, right?
And then I asked them if that satisfied their grievance, and they said yes.
Okay. That's fine. Listen, if we have only those type of grievances, we're amazing. I mean, if somebody comes to you and say, oh, somebody is touching me inappropriately, I would be concerned about that. But if we're concerned about the floors and how clean they are, that is great. So we all know how to handle that. We give it to Todd, is the, he does, or Rick, and they do the thing, they do the investigation, and you understand that, right? Okay, grievances is not only clients, it's also staff. So what happens when you have a grievance as a staff member? What do? It's confidential. Also, we have a form that you guys can fill out, fill out about a complaint, if you have any complaints, And it doesn't matter who you're complaining. You can complain about me, okay? I have no problem with that. Okay? And we're supposed to get back to you again, just like we do with clients, 24 hours. And if you're not okay with that, then we go back. And another thing, technical support. Ta-da! Luisa is not technical support. I can help you. I will do anything for you guys. But you can call Kipu yourself. They're super nice and they will help you faster than I can because I don't know everything about the program. Anything that has to be with your user, you either go to your supervisor or you can come to me or you can come to Ricky. Okay? Green light. Unless your email is not working, you can send an email to the IT guys, okay? If there's a problem, have your supervisor send an email. Or call me. I don't have a problem with you calling, but know that there's help. The phones, there's another person who deals with the phones. You should have this next to you on your desk or somewhere where you can see it. I have it in my computer. So when you call me, I know who to call, okay? Employee medical health and medical insurance, dental and vision. Did all of you get my email about who to contact when you have an issue with I know Rika did. Did anybody else? Did you? If you have an issue with your health insurance, you can call me, but it will be easier if you can contact the person who is the administrator, which is Leah, or you can call customer service at Cigna. I'm going to send another email with the information because it's really important for you to have, access to that information yourself. If you need an ID card, you can call them. If you need to know about an invoice or a claim, they can help you right away. I will have to call them and call the other person. It's better if you call directly.
Question about forget. I was told one thing as far as the insurance. When I have with my son, they said that I can add them at any time. Is it true or not? Because on the open enrollment with you guys.
If your wife has a child right now, you can add that kid right away.
Within 60 days.
Yes. If you did not add that child when the enrollment happened, you have to wait until next enrollment.
Even if he's got dropped from his insurance.
If he had insurance and he was dropped,
Yes.
you have to bring the letter where it says that he was dropped, and that is a qualifying event, and he can be included or she can be included in the plan. Yes. A qualifying event is that when you get married, when you get divorced, domestic partners. If you get married with a domestic partner too, if somebody dies, you got to take them out of the policy. Those are qualifying events. Otherwise, you have to wait until enrollment. Okay? Not because you got pregnant, you're qualified to be enrolled. Guys, you won't get pregnant. I'm talking about the ladies. One another thing. What is the disciplinary process here? Can anybody tell me? If you have not been,
Verbal warning, written warning. Second? No, formal.
and then? Okay. Suspension and then termination. Okay. If you are insubordinate to your supervisor, does he have the right to fire you on the spot? Yes, right? Okay. If you're late 3 times, 4 times, according to a policy, let's see. How many times should be you should be late so I can give you a warning? Oh, whatever. Don't film that. I do this with employees. If they're late, I change their schedule. If I can change the schedule. If I can't, then they have to do it. If you know what happens when you change the schedule? Take a guess. They're still late.
Like half an hour over that way.
Yeah, I mean, you're late. I'll give you a chance. Instead of 9, come in at 9:30. They're still late. Okay? We try to accommodate because, we have good employees, but you got to take it serious, man. And if not that you are the infractors, but, sometimes it's ridiculous. Do you have any questions? Holidays, what are the holidays? My reference is federal holidays.
Federal?
Yeah. Not state, not city holidays, it's federal holidays, whatever. If you don't have any questions, thank you guys.